can say now or whatever. Oh. Okay. Hi everyone, this is Christine. I'm going to be demonstrating how to start an IV. So the first thing that you want to do when you enter your patient's room is always double identify your patient. Hi Colin, my name is Christine. I'm going to be your nurse today. How are you feeling? He says he's doing okay. Can you just verify me your name and date of birth? So he's able to state to me his name and date of birth, and it matches his wristband. All right, thank you very much. So doctor has ordered for you to have an IV started on you because you're a little dehydrated, so we need to get some fluids in you since you aren't able to take anything orally, okay? All right, sounds good. Have you had an IV before? I'm assuming that you had one before since you've got an NG tube and stuff. You must have just lost your sight, hey? Yeah, it went bad. Okay. So that's what we're going to do is we're going to start a new IV for you. Do you have any fistulas, any grafts? I don't see any scarring on your arms at all. Anything like that? He says no. Okay. Are you right-handed or left-handed? Oh, I'm right-handed. Okay. Well, how about I take a look at your left arm first then, and then we'll see if we can use that arm so that we keep some independence with that right arm, okay? Sounds good. All right. Fantastic. So I've gathered my supplies. I have a pair of clean gloves. I've got my IV start kit. I've grabbed a couple needles and I've made sure of what we are going to be giving him. I want to make sure I put the appropriate needle size in because if it was blood products or different things like that, I would need a bigger needle. But he's just going to get IV fluids. So I'm going to go with a 22 gauge needle. He doesn't need a real big one. I've got a J-loop because at the facility that we are in, they always attach J-loops to the IV site. So I've got that, and then I've got my saline flush. So I have all my stuff prepared for you, Colin. Just going to open a few things up. Are you having any pain? He said no. So I'm just chit-chatting with him. Just going to get my stuff ready over here, okay? So we've got our tourniquet here. We have our Tegaderm gauze in case we need it. I'm going to go ahead and open up my Tegaderm. Have it so it's handy for me. I'm going to lower this table a little bit. So if you are somebody that likes to, in nursing you always want to save your back. So either raise the head of the bed up, or not the head, but the whole bed up, or lower the bed if you're somebody that wants to work on your knees. To be perfectly honest, I like to start IVs on my knees a lot, but I'll demonstrate raising the bed and then doing it that way. So always want to save your back. Okay? I'm just going to put you up in the air just so it's a little bit easier for me to get your IV in. You know, good ergonomics. There we go. Okay. So I'm taking a look at his arm. I always want to start most distally because then if this IV site goes bad, if this IV site goes bad, I can still use areas above it. But if I were to like start it up here, then I can't use any sites below it. So that's why we want to go as far distal as we can. Looks like you've got a couple good IV sites in your hand and your veins there. They look pretty good, like they'll be beneficial to us. So I'm going to go ahead and put my tourniquet about 5 to 6 inches above the site that I've chosen. If you want, I can have him dangle his arm a little bit. I can have him touch his hand a couple times, but it looks like you've got good veins there. So you just sit tight with me for a minute. I'm going to get my stuff together. I've done hand hygiene. I'm going to put on my gloves. I apologize, I don't have a brand new J-loop right now. In your kits, you'll have a new one as well as an already used one. You know, we reuse things when we can. So right now I'm going to use one that has been used before. Typically you'd see it with a cap on the end. So what I would do is I'd open up my kit, I'd pull out my J-loop, I'd loosen the cap on the end, and I'd kind of throw it back in there like that. Whoops. Lab magic, I didn't drop that. I'm going to go ahead and prepare my saline flush. If this got contaminated at all, if I touched it with anything, what I would do is I'd go ahead and grab an alcohol swab and I'd go ahead and clean it off for 10 to 15 seconds, make sure. I don't think I touched anything, but just in case I wanted to demonstrate that for you. that dry. Gonna get the air out of my flush. I'm gonna go ahead and hook up the saline to the end. And I'm gonna go ahead and prime my J-loop so that it's ready for when I start my IV. I can go ahead and get in and I can grab this real quick and hook it up. All right, so that is ready for me. I'll put that right in there. All right, what you're gonna feel next is a little cool. This is just a little Chloraseptic. So just to clean the site real good, okay? And I'm gonna go out a couple inches. There, we'll let that dry. Got my tape handy there. We never want to wave it dry or blow on it or anything like that because that's just going to bring more bacteria to the area. So we are letting that dry. Next thing I'm doing is I'm getting my stylet ready. Always what I do is I just kind of loosen it here because sometimes it's pretty tight. So if I just loosen it a little bit, then when I go to advance it after I get into the vein, it goes much, much easier for me. All right, so that is now dry. What I'm going to do is I'm going to grab his hand. I'm going to pull the skin taut a couple inches right before I plan on going in. I'm going to go in at a 10 to 15 degree angle with my bevel up. And I feel like I'm in there. I had a little give. I'm going to go ahead and, this is the one finger method, slide my stylet forward, take my hand, and I'm going to pinch out beforehand. So you see how blood is coming through there? So I'm trying to occlude that the best that I can. Next, what I'm going to do is I'm going to grab my J-loop. I'm going to go ahead and put that on there. I'm going to go ahead and release my tourniquet. And you can release your tourniquet before you put your J-loop on. I always do it after because I'm just afraid of a little more blood coming out, so I don't like to make a mess. But that's why we have this underneath. So I might just pull back a little bit just to make sure I'm still in the vessel, and then what I'm going to do is I'm going to flush with a couple cc's of normal saline to make sure it looks good. When I'm doing that, I'm assessing the site, making sure there's no swelling, no redness. Do you have any pain with that, Colin, when I flush a little bit? He says no. Great, you did a fantastic job. The site looks good. I'm going to go ahead and put my Tegaderm down. Lay that real good. I'm going to keep this because afterwards I can put my initials, date and time, because our IV sites are only good for 96 hours, unless in that meantime they become infiltrated, they start to look bad, things like that, because we're continuously watching them. So I'll get rid of that. I'm going to take off my gloves at this point. I'm going to grab a little bit of tape here and just tape down the rest of that loop. I'm going to try not to tape over the other area where I have tape, just because then it causes issues if I have to change the dressing at all and then I'm pulling at different things, something over, something under. Okay, so your site looks good. The doctor ordered for you to get fluid, so what I'm going to do now, I've already prepared that before I came into the room, so all that I need to do is hook it up. I'll just wear a pair of gloves, because anytime that you are going to be messing with somebody's IV line, whether it be a central or a peripheral line, you want to wear gloves when you're going to be touching and monitoring it and stuff. So, got my gloves on. I have my alcohol swab. I'm going to clean the end of this off real good. Like I said, I've already got this primed. The end off. I'll go ahead and hook it up, and I'll double check my doctor's order. I'll hook it up to a pump and set it to the rate that it's supposed to be at. Now with this kind of setup, it's super easy to convert to a saline lock. If doctor said, okay, he no longer needs fluids, please convert to saline lock. All that you need to do is disconnect your IV fluids. Obviously you would stop your pump, you clamp it, disconnect here. You grab a sterile cap, put a sterile cap on the end in case you were going to start the IV fluids later. Otherwise, you might just get rid of the whole setup, depending on what's happening with your patient. I'll use this as a cap, just put it on there, but it's sterile, right? And voila, I've got a saline lock. What I'm going to do though still, if it wasn't just normal saline running through there, what I would do is I would grab another saline lock because I want to flush whatever is in this line through. So I will go ahead, open this up, take the cap off, alcohol swab off again, hook it back in, and flush it with about 2 to 3 mLs of normal saline, depending on what the protocol is at your facility, whatever that policy is, for how much that you are going to flush. So what I'm going to do with this IV site afterwards is I'm going to continue to monitor it every hour to 2 hours. Every time I'm in here, I'm going to take a look at it, looking for any swelling, any redness, any pain, any signs of infiltration or infection. If there starts to be drainage at the site, that's very concerning. I'm also, after I put the IV site in, I'm going to document. So I'm going to document the location, the gauge of the needle, how the patient tolerated the procedure, what I dressed it with, how the site looks. And that is about that. So that is starting an IV.